Cranial sensory motor dysfunctions in long COVID and COVID vaccine injury patients, Part 1. In this YouTube, we will contrast sensory motor dysfunctions that occur in the cranial regions, particularly ocular dysfunctions, as sequelae to COVID infections, contrasting these with similar dysfunctions that have been reported as a sequelae to COVID vaccines. These are COVID vaccine injuries. The paper on the left from 2022, Ocular Motility Disorders Following Coronavirus Disease 19 Vaccination. These types of vaccine-induced ocular motor dysfunctions are not new. On the right is a report at a conference from 2013 on cranial nerve vaccine injuries. Cases of strabismus reported after hexavalent vaccination. What is strabismus? Strabismus is an eye condition where both eyes do not line up in the same direction. One eye focuses on a target, while the other eye turns inward, outward, upward, or downward. It is commonly known as crossed eyes or squint. Strabismus is a minority of the persistent vision problems that have been reported in long COVID patients. This review, persistent vision problems after COVID linked to ongoing inflammation and nerve damage, comes from CIDRAP at the University of Minnesota. And they are discussing this paper, which was published in July 2026, long-term ocular symptoms following COVID-19 linked to immune dysregulation, dysautonomia, and peripheral neuropathy. Although less well known than other long COVID symptoms, ocular symptoms like pain, light sensitivity, blurred vision, and difficulty reading affect up to 31 to 35% of people with the condition, the study authors note. But this abnormal eye behavior cannot be detected by standard methods, making it difficult for patients to get a diagnosis or treatment. Now, connecting this recent paper with a review from 2025, Neuroimmune Pathophysiology of Long COVID. Here are 5 categories of histopathological events that can lead to dysfunctions of the nervous system. Neuroinflammation, which includes the activation of microglia and astrocytes. Barrier dysfunction, for instance, breakdown of the blood-brain barrier. Vascular dysfunction, neurotransmitter metabolism being altered, and neurodegeneration. In a prior YouTube on this channel, we introduced the importance of the perineurium in neuropathologies, particularly long COVID, and the reactivation of herpes viruses. So we are discussing the importance of a specific class of glial cells. These are known as perineurial glia. These are the glial cells that compose the perineurium, which is the connective tissue sheath that surrounds axon bundles in peripheral nerves. This includes cranial nerves. Over on the lower left, we are emphasizing key concepts to understand the histopathogenesis as well as the etiologies that underlie damage to the peripheral nervous system. A key concept is the perineurium. Once again, it is a connective tissue sheath surrounding a bundle of axons. It contains perineurial glial cells which secrete an extracellular matrix. The perineurium is a tissue barrier which helps protect axons from being infected by viruses. However, certain viruses are able to disrupt the perineurium and gain access to the axons, the neurons that lie interior of the perineurium. As discussed in a prior YouTube on this channel, HSV1 has been found to infect the perinuria, that is plural of the perineurium of the trigeminal nerve, cranial nerve 5, in an inbred rat strain. That YouTube, the link to it is shown in the lower right. In addition to herpes viruses infecting cranial nerves, they can be reactivated, and this has been documented both in response to COVID as well as COVID vaccines. In addition, ancient fossil viruses known as HERV viruses, human endogenous retroviruses, can also transactivate in response to viral infections such as CoV-2 infections. The reactivation of herpes viruses and HERV viruses within peripheral nerves, including the cranial nerves, are known to produce neurological maladies. And one of the ganglia that needs to be looked at in terms of ocular dysfunctions in long COVID patients is the ciliary ganglion. The ciliary ganglion receives inputs from multiple cranial nerves as well as a sympathetic nerve and a parasympathetic nerve. It then branches anteriorly, and in this projection there are 8 to 10 anterior branches known as short ciliary nerves. These short ciliary nerves subdivide and innervate specific portions of the eye. Primary functions are pupil constriction and lens accommodation. These are of particular importance for the discussion of ocular symptoms in long COVID patients. Pupil dysfunction in long COVID involves weakened autonomic reflexes, altered task-evoked pupillary dynamics, and abnormal light responses linked to ocular dysautonomia, small fiber neuropathy, and persistent T-cell mediated neuroinflammation. Pupillary dysfunction is common in long COVID patients who have ocular symptoms. It is an open question whether HSV1 reactivation is taking place in the ciliary ganglia of these long COVID patients. Here is some information that bears on this question. 2 references at the bottom of the slide. Detection of herpes simplex virus type 1 in human ciliary ganglia. This is a paper from 2002. So this demonstrates that HSV1 can infect the ciliary ganglia in humans. The second reference, 4th and 6th nerve palsies due to herpes simplex 1 infection. This paper is from 2015. The 6th cranial nerve, when it fails to fire, results in loss of function of a specific muscle that moves the eye, and this results in strabismus, which we mentioned earlier in this YouTube. I would now like to transition specifically to strabismus as a means of analyzing the question of whether HSV1 can reactivate in cranial nerves and the ciliary ganglion in long COVID patients, and in doing so, be the upstream driver of some of the ocular dysfunctions that are recorded in about 30 to 35% of long COVID patients. So first, a basic question. Do eye movements involve reciprocal inhibition? Limbs utilize reciprocal inhibition between agonist and antagonistic muscles that move a limb around a joint. So this question is the same type of neurological, neuromuscular organization present in the eyes? And the answer is yes. eye movements involve reciprocal inhibition. When one eye muscle contracts to move the eye, the opposing muscle receives a simultaneous inhibitory signal to relax. This coordination ensures smooth, precise tracking and fast shifts in gaze. How it works in the eye. Just like an arm or a leg, there are antagonistic pairs of muscles. In the eye, muscles like the medial rectus and lateral rectus pull the eye in opposite directions. There are simultaneous signals. When an agonist muscle gets an active signal to pull, the brain sends an inhibitory signal to the antagonistic muscle, reducing its activity. Clean coordination. This process stops both muscles from fighting each other, so the eye moves cleanly to the target. This is normal function. When cranial nerves are impaired by inflammation and or viral infection, one will anticipate changes in gaze, the positioning of the eyes. And this brings us to the question, how to treat these disorders in long COVID patients and also COVID vaccine injury patients. Can dry eye disease treatments be repurposed for the above injuries? I'd like to draw your attention to 4 key references on the left, and we will discuss these in more detail in part 2 of this series. First, calcitriol, the active metabolite of vitamin D3, inhibits dry eye-related corneal inflammation in vivo and in vitro. Calcitriol is the kidney metabolite of vitamin D3. It is doubly hydroxylated. It is the most active vitamin D metabolite in terms of stimulating vitamin D receptors, which carry out anti-inflammatory, antioxidant activities, and the vitamin D receptor also helps promote tissue integrity as well as tissue healing. So this immune hormone is synthesized primarily in the kidney, but also in ocular tissues, such as the lacrimal glands, as well as the cornea. Calcitriol inhibits apoptosis, programmed cell death, via activation of autophagy in hyperosmotic stress stimulated corneal epithelial cells in vivo and in vitro. Low expression of vitamin D receptor in patients with dry eye disease. Many long COVID patients have dry eye disease. Finally, calcitriol alleviates hyperosmotic stress-induced corneal epithelial cell damage via inhibiting a pathway which promotes pyroptosis in dry eye disease. So can vitamin D receptor agonists such as calcitriol or a synthetic version of calcitriol, paracalcitol, be used to treat cranial sensory motor dysfunctions in long COVID and COVID vaccine injury patients? We will discuss this issue in part 2 of this series.